Probably, inject a little bit more local anesthetic in and around the area. Hold on for a minute here. Oops, sorry. Okay. Hold on here. Expires in 2002. What the hell? Anyway, hold on. Okay, I'm going to use approximately another about 2 cc's more of xylocaine or lidocaine. Now, I am allergic to lidocaine, so I am expecting to go into anaphylactic shock any minute now, but fortunately I do have an epinephrine pen here, so I will immediately inject myself probably into the tongue. It should make quite an interesting sight. Only kidding! Anyway, hold on. Okay, again, I prepped the area, this time just with alcohol, and I will, attempt a little further into the lesion itself, I think. A little stick here. Ooh, that's not bad. Oh, I like that. Yeah, it's good. Okay. Anyway, again, this is not for the faint of heart, nor would I recommend this treatment at home, unless you're, as nuts as I am. That stings a little bit. And just don't want to go to a doctor because you're lazy. Besides, I am a professional. Well, good Lord, there's a giant mosquito right here. That's just great. This blood-sucking asshole. All right. Anyway, obviously not a sterile environment, but anyway, so we're going to go a little further down here, try and create that wheel of local anesthesia a little further. Wait a minute here. Okay, make sure we're not in the artery. A little further medially here towards the inner aspect of my leg. And raise that wheel a little further around. Again, this is not necessarily this is not a nerve block per se. To do a nerve block, I'd probably have to go further up by the knee, do the saphenous nerve, maybe a little harder to do. But that would anesthetize the entire lower extremity on this side, and I don't want to do that. I'm just going to put a little further down in here. I don't know where my gloves are. Somebody stole my gloves. Then again, it's me, so I just already got my own germs in me. Okay. Alrighty. Well, it's still pretty tender there. Alright. Well, I didn't want to have to go directly into the lesion itself, especially if it's infected. You don't like to generally put local anesthetic directly into a abscessed area. It just depends, really. So, make sure we got a closer in there. Generally hard to anesthetize a superficial area like this, as some of the nerves infiltrating the area could be deeper, not necessarily a superficial skin nerves. So, but like I said, I'm not going to do a total nerve block of myself. We used to do that in school, but on each other, not necessarily ourselves. So a total of about 5 cc's. You don't want to overdose on the xylocaine. I mean, I'm still well below the toxic range. But I'm just going to put that in around there and make sure got enough in there to at least make it somewhat numb. Doing incision and drainage. All right. So, again, wipe that off. This can be used for a teaching tool in school. Oh, basically, know what to do to yourself. Okay. All right. I'm going to give that a few more minutes, see if it gets any more anesthetized. Be back in a little bit. Okay. It's starting to get a bit. Oh, that's my assistant, Benjamin. He's here to pick up any blood that may fall on the floor. I'm going to just wipe this off with some betadine, prep the area again with a little more betadine, as the area is now becoming fairly anesthetized. I mean, I can still feel some discomfort pressing on this. nowhere near what it was before earlier in the day. I mean, it was extremely painful. Obviously, some localized cellulitis there, probably causing some, minor systemic symptoms. A little, feeling a little ill, but nothing really that bad. Yeah, definitely more anesthetized than it was previously before the 2 injections. Now, again, you would like to create a sterile field as much as possible, but we are dealing with an infection, so obviously there's bacteria already there, but we just don't want to introduce any more bacteria into the wound. So we want to clean that off as much as possible. We don't want to develop any kind of staph infection or anything else, obviously. But we will see what we can see here in a minute. Okay, be back in a minute. Now, I do like to use the Bard Parker sterile blades. We're going to use a number 15, a smaller blade. We don't need a very big blade. And a number 3 surgical handle. Be right back. This is the Bard Parker 15 blade, number 3 handle. This blade is sterile. It's just right out of the wrapper. As soon as I touch anything to it, like my wound, obviously it's not sterile anymore, but that's just to be expected. Okay, be right back. Okay, the area is about as prepped as it's going to be. What we're going to try and do here